Hi everybody, Dr. Cary here, just working on some video edits from our webinar, which was last week, called Understanding and Treating Headaches and Facial Pain. I hope you enjoy these edits. It was a highly watched YouTube video, and I'm going to give you some shorter clips so you can watch the individual slides here on social media and on YouTube. If you're interested in becoming a patient in our clinic, please click on the link in the bio or the show notes below. We're accepting new patients. If you're not in the Kelowna area, you can click on the link to our consulting website. We'd be happy to help you with some health coaching, as well as direct you to a chiropractor in the area that does this type of work.
And when someone has a pinched nerve, especially in the neck region, in the upper part of the neck, this can cause a headache. So I've seen a lot of people with a pinched nerve in the neck area, and that can cause pain that radiates up from the upper part of your neck going around the top of the head above the eyes. And this is the greater occipital nerve that's affected, coming from the back of the skull and the upper part of your neck. There's another nerve, the lesser occipital nerve. It kind of goes around the ear to the temple. So that's another possibility for a cause of a headache, is when the nerves get pinched. And I'm going to show you right here on YouTube what that looks like. So let's see if I can get this slide up for you guys and just show you. Okay, no, I can't get that slide up. Sorry guys, I was testing this before we started, but I can't get that slide of the anatomy of the neck up. Okay, so pinched nerves can cause headaches. Neck misalignments, especially at C1 and C2, the top two vertebrae in the neck, can cause headaches. Stress, we talked about that. Dehydration is another one. So sometimes when people are dehydrated and their body lacks fluids, that can cause a headache. So drinking enough fluid, especially in the summer, or if you're in a dry climate, very important. As well as taking in some salts or electrolytes, that's important too. That's something I like to talk about here in the clinic and recommend to people. So all very important, as well as your posture. And posture, you know, when you're slouching or your neck's kinked off to one side, this can cause headaches as well, because it can put pressure on a certain area. It can affect the blood flow going through that area, as well as the nerve flow. So very important. And that's something chiropractic is very good at treating, is pinched nerves, misalignments, and poor posture. In the Kelowna area, then you can always reach out to me. You can message me here or send me a DM, and I'll try and find a chiropractor in your area. I've done that for many people in Toronto, Saskatchewan, Vancouver, Victoria, the US, Palm Springs, LA, places like that. So I'll find a chiropractor for you that does a similar technique to what we were talking about today. Just going to close this window. I'll open this one